Hi, my name is Jennifer Rigdon, and I am a proud board member of the American Cancer Society Missouri Board, and I'm thrilled to once again host our Society Chat series. Today, I want to welcome Dr. Melissa Tapey, who is a board-certified OBGYN and the Chief Medical Director at Affinia Healthcare. So thank you so much for being with us. I'm thrilled that you're here, especially because we're going to be talking about National Women's History or Health Month. We've already had History Month, and now we're going to have Health Month. And you're going to talk to us today a little bit about women's health and screening, especially for cervical cancer. So let me get started with our first question. Many women are really confused about how often they should have their screening for cervical cancer. And I know that a lot of women are apprehensive about it anyway, so new rules around it are making people even more apprehensive, including the pandemic, et cetera. So what can you tell us about the frequency and why you should get your women's health screening regularly?
Yeah, this is a great question. It has changed. I have now been a physician for 15 years, and it has changed over time. So I think it's a great question. First off, just to remind everyone that a pap smear, right, or a pap test is one specific test that we do that screens for cervical cancer. And it takes a small sample of cells from your cervix and looks at them under the microscope. And nowadays also includes oftentimes a test for HPV, or the human papillomavirus, which is the virus that we now know causes most cervical cancer. So the pap 20 years ago didn't do both things. And it was different. And so now, given that we can have more information about what we're screening for, you can start your pap smears or your cervical cancer screening at the age of 21. And in general, from ages 21 to 29, what we're testing for are the cells to make sure that they look normal. If they don't look quite normal under the microscope, we may actually add an HPV test on for the virus to help us figure out if someone's actually higher risk for cervical cancer or not. And then once you get to the age of 30, so ages 30 through 65, that pap test really is every 5 years if completely negative. And that test is both the cells of the cervix and HPV. So we test for both of those things at the same time. That way, if both of them are negative, we know the chance of you getting cervical cancer is super, super, super low. And that's why those tests can be spaced out for 5 years. So in your 20s, if it's normal, it can be spaced out every 3. And once you're over 30, every 5. And that's really why it's spaced out that way. It's not just, wasn't a random decision. It's not because we think you're going to, it's really because we don't think we're going to miss anything in those years because your testing was so good. Some folks are on different schedules because the test wasn't quite normal. And so maybe they do need a pap smear in a year. But we will let them know that based on results. And I will say too, you know, for women who are often busy, still come get your yearly exam. The pap test is not the only thing or not the only test that we do. We're also looking for, you know, we're doing breast cancer screening. We're screening for, you know, weight and health management like diabetes and your blood pressure, depression screening, your sexual health and infections. And again, planning or not planning for pregnancy and what you want to do in that arena as well.
Very good. Now, it's interesting that American Cancer Society is really pushing a return to screening because people put off a lot of screening during the pandemic. Completely understandable. But that means some cancers aren't being caught. Now, we know that there's been a huge breakthrough in cancer prevention with the HPV vaccine. So the HPV vaccine is available for boys and girls at a certain age, and I'm sure you'll tell us about that. And it can actually prevent cervical cancer. So it's actual cancer prevention in a shot, which is amazing to me. We've made so many strides. Why is it so important for adolescents to get the HPV vaccine?
Yeah, great question. So again, HPV, the human papillomavirus, that really causes almost all cervical cancers, as well as some other cancers like oral and throat cancers. So dentists will often talk about this. Also anal cancer. So this vaccine prevents against multiple strains of that HPV or human papillomavirus. And the most common way we get that is through sexual intercourse. And so it's very, very important just to have this Gardasil or the HPV vaccine within the normal series of adolescent vaccinations. It is cancer prevention, just like you're preventing other diseases. You get it once every year if you get it under 15. So we recommend it, just getting it with your other vaccines, usually at the age of 11 and 12. That's also a really great time because it doesn't necessarily for your children, right, kind of put HPV in the same category as I'm also talking about sex or sexual health. You of course can if you want, but at this point, almost all, if not all children really haven't had sexual intercourse. So they are getting this vaccine at a really great time because their body would have never been able to see this virus, which is the best time to give it and the most effective time to give it. You see countries that have really high uptake rates of the HPV vaccine, and they really almost have very, very minimal levels of these types of cancers in the patients that have been able to get the vaccine. And for those of you who are already past this age group, right, you can get the HPV at later years as well. If you're over 15, it's a 3-dose regimen. So you get the first one, and then 2 months later get the second one, and 6 months later get the third one. Also can be effective, but the best age group, the most effective age group is going to be that 2 shots a year apart. They can get them at their yearly physicals at around 11 and 12 years old.
So is there a maximum age where you can get the HPV vaccine if you didn't get it as an adolescent?
That's also a great question. So this has also changed over time. So the original kind of maximum was around 26, 27 years old. Now it goes all the way up to 47. And wow. I think it's, again, a good thing to think about or discuss with your physician, especially if you're someone whose life has changed. So say you're recently divorced and may have new sexual partners, or for whatever reason you choose, right, that you do have multiple sexual partners or may have different risk factors that change over your lifetime. Then again, it's something that you should really consider and talk to your physician about. So then even up to the age of 47, consider getting the HPV vaccine.
That's amazing. I know that I had both of my kids vaccinated for HPV, both my daughter and my son. Yep. When they were adolescents. We just lucked out on the timing. So what should parents do if they're hesitant about this vaccine?
So I think the most important thing is to educate yourself, right? If you feel comfortable online, going to the American Cancer Society website, right? Going to the Center for Disease Control or the CDC website that we've all become more familiar with due to the COVID pandemic. I also got my daughter vaccinated. My son is coming up, so he'll get vaccinated as well. It's important to get boys and girls vaccinated. And again, talk to your pediatrician, family medicine physician, or clinician. They have all of the science and the evidence behind these vaccines. They are knowledgeable. We hope that you trust them, and so they can answer your questions so that you can really feel comfortable with your choice.
Perfect. I have one last question for you. American Cancer Society is really focused on health equity, making sure everybody has access to the health care that they need. Mm-hmm. So what barriers to cancer prevention are you seeing most with women who, are challenged with getting care?
Yeah, I think there's several barriers and challenges that we see. Especially on the health equity line. I think right now, especially with COVID, folks are scared. We're all still getting back in the routine of, coming out of the house, doing things that are preventive instead of just focusing on the problems at hand, right? And trying to stay safe and kind of in our little bubbles. So knowing that the clinics or offices are safe, right? We really haven't had transmissions in our offices, and we've now been open we've been open throughout the pandemic. So very comfortable with the masking and the asking of symptoms to keep both our staff and our patients safe. So I do think it's safe to come out. And again, trust, right? Build that trusting relationship with your physician or clinician. We know historically that the medical system has not always treated everyone fairly, particularly African Americans and other groups of color. but come out, we're going to continue to work to make sure we build that trust and keep that trust. Because we also don't want you to be scared to get screened because you might learn that you have something bad, right? Like a cancer. No one wants to hear that word. But always better to be screened and to learn about it earlier, because we also know there are health inequities, especially for African American women learning about breast cancer later or cervical cancer later, and it's much harder to treat. So having that trusting relationship and building on that, especially when things are okay and early on, so that, you know, hopefully none of us ever get bad news. But if we get bad news, we have a trusting relationship in which to discuss that, and that we catch it early so that it can be treated. And then we also work on things, you know, financial things like coverage, right? So I want women to know too that it's not always simple, but we have ways to get these things covered, right? So if you have insurance, great. But, you know, if you don't, sometimes Medicaid is an option. In the St. Louis city and county, we have Gateway to Better Health as an option, or Show Me Healthy Women from the state, Komen funds for breast cancer screening, right? So there's different funds that we can get so that everyone can get the cancer screening they need. We're also sure to make sure we have, you know, interpreters and translators and other languages for folks that need that. Transportation, we will also assist with that. And I think for women too, we're often caregivers, and we focus on lots of other people and caring for them. And just remember that you are also valued and important, and you need to put yourself first as well when it comes to your health.
This has been a fantastic conversation, Dr. Tapey. I really appreciate your time. And I want everybody to know that Dr. Tapey, her team, and the American Cancer Society care about your health. We want you to get screened. We want you to do all the things that will help you prevent cancer so that you don't have to have that conversation. Yeah. Thank you so much for being with us.
You're welcome.
Really appreciate your time.
You're very welcome. Thank you for having me.